Hi, everyone. My name is Dr. Miriam Thompson, and I'm an assistant teaching professor in the school psychology program in the Department of Counseling, Clinical, and School Psychology in the Gevirtz Graduate School of Education here at UCSB. It's my pleasure to welcome you all to the University of California, Santa Barbara. A question that I'm happy to answer, and it's a commonly asked question, is what kind of assessment experiences can I expect to receive in our program? And this, again, is for all students, not just for school psychology students, but for students in the Counseling, Clinical, and School Psychology program, CCSP. So I teach the majority of the assessment courses here in our program. I teach cognitive assessment. I also teach personality assessment, neuropsychological assessment, and in the past, I've taught psychoeducational assessment. So I teach a lot of assessment courses. So for school psychology students, you can expect to take cognitive assessment the first quarter of your first year. So you really hit the ground running in terms of your immersion in the assessment experiences here in our program. And in my course in cognitive assessment, which I'm actually currently teaching, students really get a hands-on approach in terms of learning these different assessments. There are many moving components, but what students will tell you is not to let the experience overwhelm you initially. I'm here to guide you as your instructor, and you'll really be able to hear from my experiences as a supervisor, because I'm also the director of the Mind and Behavior Assessment Clinic, which I'll talk a little bit more in just a few moments. But in terms of what you can expect with regard to your assessment experiences, again, you will be well supported. You'll get a lot of hands-on training, a lot of practice as well, in terms of learning to kind of develop kind of like a mastery, or learn how to really truly dominate some of these assessments and just really get to a point where you feel calm, confident, and in control. I use the 3 C's a lot with my students because I want them to feel comfortable, confident, and in control as they're administering these assessments. And another thing is just to embrace the mistakes that you'll make, because you're a student, you're in training, you're learning. So of course, mistakes will happen along the way. So that's what a little bit about what you can expect in a nutshell. Another important component of my role here as faculty is that I'm the director of the Mind and Behavior Assessment Clinic. So the Mind and Behavior Assessment Clinic, known as MBAC, is an opportunity for graduate students in our program to get firsthand experience in administering these assessments to people in the community. We accept a wide range of referral concerns, so like neurodevelopmental disorders, and that would, underneath the umbrella of neurodevelopmental disorders, that would include specific learning disorders, um, intellectual disorders, autism spectrum disorders, although really we try to refer people to the Kegel Autism Center next door. And interestingly enough, in the past, we have collaborated with them when we have discovered that some of our clients end up meeting criteria for autism spectrum disorder. We also respond to other referral concerns such as anxiety disorders, depressive disorders, personality disorders, and trauma and stress related disorders as well. So students in the clinic, student clinicians that I supervise, really are able to accumulate a wealth of experiences, and they are all supervised by me. So again, just to kind of sum this up, you can expect to really receive a range of assessment experiences. And as you are acquiring these experiences, you're supported, you're guided, you're supervised by me for many of them. You're also supervised by other faculty. And so you should know that you're not going into this experience alone, that there will be people there guiding you. So again, welcome, and I hope that you enjoy the interview experience.